in the atrium, and they kind of look like columns here. So they're underneath the auricle and within the atrium. Those are called pectinate muscles. And that's just because they look, to somebody, they look like the comb, the teeth on a comb. And then you have two types of muscles in the ventricles. The ones here that are a little ridged and occupy, the lateral side, that's trabeculae carnae, columns of flesh. And you can really see it, I think, on the back side of this muscle. So all of these columns in the ventricle, trabeculae carnae. And then you have some specialized muscles that are real large and kind of come up into the ventricle and attach to these strings. So those are called papillary muscles, like the dermal papilla. So they're just big pegs that kind of come up. And they're the only ones that attach to the cords. And the cords are, your Saladin calls them tendinous cords, and that's what they are, but in Latin it's chordae tendineae. They pull on these valves and make sure that the valves stay open. So you've got muscles that provide tension to the cords that help with the function of those valves. Tricuspid valve, bicuspid valve. So that covers the muscles. And then we had a couple of features. So in the right atrium, we mentioned the opening to the coronary sinus. And then there is a depression in here. So it's a circle that's all filled in, and that's fossa ovalis. So in the adult, it should be filled and complete so that you have a wall between right atrium and left atrium. But in fetal hearts, they don't have developed lungs, so they don't need to direct specifically all the right ventricle blood to the pulmonary trunk out to lungs that aren't going to oxygenate it anyway. So the fossa ovalis is foramen ovalis in the fetus, so that it provides, access between right and left atria, so that most of the blood goes out to the body and not to the lungs. And another feature that's in the fetus but not in the adult, there's this white area underneath the aorta that people have drawn on. So that's ligamentum arteriosum. So now it's a ligament in the adult that separates aorta and pulmonary trunk. But again, in the fetus, if blood goes from the right ventricle through the pulmonary trunk out to non-functional lungs, that's not helpful. So that used to be a channel, a connection between pulmonary trunk and aorta, so that most of the blood, again, could go out to the body. So in the fetus, it's ductus arteriosum. And here's ligamentum, just fibrous tissue.
I was about to ask you that, because I've heard of patent ductus when the premature...
Where it's not closed. And that is problematic. Like you need distinct, channels and pathways for deoxygenated and oxygenated. Let's see. Did I miss anything? I don't think so.
So the ligamentum arteriosum